In the 1920s, there was this former school teacher in Dallas. So he was the superintendent of the Dallas public school system, and they had this problem, which all goes back to, this is why we need paid sick days. But basically, people would show up to work sick. Teachers would show up to work sick because if they didn't show up, they didn't get paid. And so he created for the Dallas public school system a sick fund where everyone would pay into it. And then if they didn't show up to work, they would get some portion of their pay through the sick fund. And this was really popular. The teachers liked it. And he was like, great. All right. You know, if they were seriously ill, they could get money back from the sick fund that they had paid into. Social insurance models were very popular at the time, and this is a version of it. So he leaves the Dallas public school system and works for Baylor Hospital in Dallas. And it's 1929, right? It's right as the crash is taking place, and hospitals are seeing their financing model break because they're no longer just places that charities would support as people go and die. They're now places that actually provide care and surgeries and things like that. So this guy, his name is John Ford Kimball. Hold on. He's got 3 names. I think I got at least 2 of them wrong. His name is Dr. Richard Kimball. No. Damn it.
You're sick. I don't care.
I don't care. His name was Justin Ford Kimball. So he started out as the superintendent of Dallas schools, and he came up with this sick leave.
The sick leave thing was in the school part system. Of the school systems.
And then when he left the superintendency of Dallas Public Schools and went to Baylor Hospital in Dallas and also oversaw the Baylor Hospital or the medical school and dental school and nursing school, he got the big job. He went to the hospital. The hospital's financial system was kind of cratering under this switch over what it is hospitals are meant to do. So he went back to the Dallas school teachers and he said, all right, we can basically take what we did for this sick leave fund and put it into a hospital fund. So you pay 50 cents a month, and that will buy you like 21 days of hospital services. And that is really the first successful private health insurance plan in the United States. Other people had been trying it, but they couldn't get it to work of like what was covered, what was not covered. And this is basically a co-op model of private health insurance that he sells to the Dallas public school system from his new position as no longer superintendent, but head of administrator of the Baylor Hospital. And if you read certain histories of it, like a couple of things go his way. Like right after he does it, it's like a really bad winter. And like one woman signs up and then 4 hours later has to go to the hospital for an emergency appendectomy. And she's like, oh, thank God I had it. She had just signed up. So it ends up the Dallas Morning News, I think the Dallas radio station, they immediately sign up and then they basically fill up all the spots they have for this private health insurance system. And hospitals all over the country start to pick up on this model.
So I'm sorry, the staff of the newspaper, I thought you were going to say that they got covered in the news. But
it got covered in the news, and then as they were covering it, they all signed up too.
Oh, really?
Yeah.
This is why you pay attention to the news. You get ahead of the things.
Yeah, just journalists up on the ground floor. But this was referred to as the Baylor Plan. The Baylor Plan, as defined by Justin Ford Kimball, is it's often pointed to as the first successful private health insurance plan. And because he used to be because it ends up being an employer plan on some level just because he was part of the Dallas public school system for so long as superintendent that he's basically the first person he pitched it to. Mm-hmm. They were the first. Pitched it to his former employer. They were the first people he pitched it to because he's like, I bet teachers would like this.
Yeah. And were people using that to get just regular medical care, or was it only like something as serious and it's hospitalization care?
It was hospitalization, but not long after. So in the 30s, kind of you put this on a timer, he does this Baylor plan is first proposed in 1929 off of the sick fund that he had proposed in 1921. By the time you get to around 1940, the American Hospital Association has picked up on this plan, and it'll eventually become Blue Cross.
Oh.
This is Blue Cross. So the Baylor plan we know today as Blue Cross, and it becomes a plan adopted by hospitals across the country as Blue Cross. Now, the American Medical Association, which are doctors, they realize that they can come up with a plan that's quite similar, and so they develop a similar one. You pay a fixed fee per month. It gets you a certain amount of services, and they call theirs will become Blue Shield.
So we can blame Texas for all that ails our health insurance system. No, I'm just kidding.
Come on. No, I would say no. Like at this point, like this is what's in the this is what's in the mix. At the same time, many public legislators and researchers are trying to come up with a version of a national health insurance system kind of as these plans. So you've got kind of bubbling in the background is how healthcare is delivered in the United States and the shifting preferences from where you go see a doctor and what hospitals are for. You've got co-ops like the Baylor plan becoming Blue Cross that are taking hold across the U.S. and Blue Shield latching onto it. Well, at the kind of like the third thing is
third
that
leg.
The third leg is that since Teddy Roosevelt, presidents and administrations have been trying to come up with a successful national health plan. Roosevelt 1 had one and endorsed one. Roosevelt 2 had one and endorsed one. It was something that was very important to Queen Frances Perkins. And all three of these things basically hit World War II.